My name is Dr. Kenneth Ward. I'm an optometrist at Fraser Eye Care. So I studied biology at Oakland University, just down the street. And then I went to what's called the Illinois College of Optometry in Chicago for my doctorate degree. So I specialize in what we would call primary care, which is basically just all-encompassing eye care, whether it's glasses prescriptions, contacts prescriptions, diabetic eye exams, seeing you before or after any surgeries, pretty much anything to do with the eyes. What inspired me to become an optometrist? I would say definitely exposed to a lot of medicine and different parts of the medical field when I was younger. I have some different family members who are in medicine, and one thing that always stuck out to me about eye care was, for one, how happy everybody seemed, not just the patients, but the providers as well. There's a lot of job satisfaction here, and that's definitely something that's important, of course, with any job. And then second to that, I would say, like I mentioned, the patients as well. So it's definitely a tangible part of medicine where you can treat somebody for a condition or have a visual complaint or blurriness or whatever it is, and put a pair of glasses on them in a lot of cases and see the result right in front of you, which definitely gets a lot of positive feedback. So a friend of mine actually that I went to school with, Dr. Altawage, also works here. I'd heard about an opening here, and then a lot of really good feedback about the surgeons, the company itself, and just the breadth of what we all treat here at Fraser. And it inspired me to make a move over here. What I love most about being an optometrist, I would say, it's a very hands-on job. There's a ton of different things and tools at our disposal to treat different ocular diseases and conditions. There's a lot of cutting-edge technology always coming out. And so as a nerd in general, it's just a really fun field to be in, really fun part of medicine to be in. My approach to patient care, I would say, is definitely trying to level with the patient as much as I can. So I pride myself on being able to explain things in a way that I think will be understandable to most people, and also just keeping a beat on, is the patient picking up, what I'm putting down, and are they understanding what they need to do from their end as well. And I think it's a lot of fun to be able to get that recognition from the patient and seeing that they can take a part in treating their own conditions. I've prided myself as a photographer for many years now, been very into that, especially since I started optometry school. The eye and the camera are not all that different, and so there's a lot of parity between understanding the two things, and that actually helped a lot getting through school, as well as becoming a better photographer. One or two, it's always two. Coffee, 100%. This is a tough one. I would have previously said night, but I'm becoming more of a morning person these days. Dogs, 100%. Depends on the day. I would say adventure for the most part, but it's never bad. Never a bad time to just sit on the couch for a little while. And that's always a hard question because it depends on where the island is, right? Is it warm climate? Is it not? So obviously sunglasses, because you got to protect your eyes, right? That's number one. If, again, assuming we're out in the sun, I would say water for sure, because you might be in the middle of a body of salt water. And then, I don't know, maybe a book or something to pass the time.